Health Minister Dr. Zweli Mkhize is set to rearrange government's COVID-19 Ministerial Advisory Committee. After dissolving it in its current form earlier this week, several of the medical experts from the committee disagreed with the government's handling of the epidemic. Professor Francois Venter was a member of the committee and joins me via Skype from Johannesburg now. Prof, thanks a lot for joining us this evening. Can we indeed confirm that the Health Minister Zweli Mkhize has disbanded the government Scientific Advisory Committee on the coronavirus? As a member, can you confirm that indeed you have been disbanded?
Many of us have received a letter saying that we have been terminated in terms of the committee.
And have any reasons been given for that disbandment?
No, I think that the epidemic has transformed. I think there is reason to perhaps transform the committee, to look at it in a different way, because things have really moved a lot since February. But I think government desperately still needs good advice from experts.
Yeah, I mean, you're saying government needs good advice from experts. On the one side of it, you're alleged to have disagreed with the government's decision to curb economic activities, obviously in a bid to slow the spreading of the virus. As the country now sits on level 1, and you're saying that they still need to be advised, how do you think that they can best, contain, maintain, manage the virus, and even be advised to even avoid a second surge?
South Africa has some of the best pandemic experts in the world to advise them from everything from the clinical management across to how the epidemic is likely to evolve. It's really difficult to understand why they haven't enlisted that expertise. Instead, they've brought in WHO experts, external experts. It's almost as if they don't want to be advised by their own people. We have sufficient internal expertise across the country on different levels of specialization that they could easily enlist.
Yeah, I mean, is there something that is personal when it comes to the way in which government has decided to handle the coronavirus as well as advice related to the pandemic going forward? I mean, you're saying that they could draw on the advice as well as the expertise of some of the local doctors, specialists who are really world-renowned, but they're opting for almost international and external advice. Is it personal?
It's inexplicable. I think one thing that's characterized the response to this epidemic is a lack of transparency. We're not fighting a war here against an external agency that requires all the secrecy. What we need is openness. We need transparency. Government just needs to explain some of these decisions. And unfortunately, the disbanding of this committee has added to a country's anxiety where they haven't understood a whole range of governments' quite strange decisions about some of the things it's done, and this just adds to it. Another decision on the wave of others that people don't start to trust what you've got to say. As I said, I don't think the current committee needed to be in exactly the way it was. I think that things have changed, but to suddenly just disband everything and not say why, and also not say what you've got to replace it, is very, very worrying.
You've worked in in the committee there, Prof, so you would know directly in terms of exactly the type of management communication that exists within the committee in itself. What do you think is being hidden? What do you think government is trying to hide that they've not come forward and become transparent about? Is it when it comes to the rate of infections? Is it about the numbers on the ground? Is it the handling of the pandemic? What are they hiding, in your opinion?
I'm not even sure they're hiding. Sometimes I worry that they're just not being transparent about things that they could be. Nobody expected government to get this perfect. This is unprecedented. This epidemic, the way it's behaved, the way it's impacted on our society. None of us I don't think any of us expected them to get it completely correct. But in the midst of all of this, what I think we did expect is to just have it explained to us. And instead, we've had these high-handed decisions which just don't make sense. And I completely believe that there are many different actors in this, different things to consider, but just take the nation into your confidence and tell them what are those factors. If you're not going to open up the taxi industry, and it doesn't make sense to have taxis that are crowded, tell the nation why you made that decision. If you're going to open churches, tell them what guided that decision. There are good scientific decisions. There are a whole range of things. Panning the commercial space, the manufacturing space, which may not just be medical space, but tell people why you're taking this forward. And unfortunately, again, with this committee, is you've got a whole lot of experts in place. Who are you putting to advise you? Who's going to tell you what to do? We don't need external expertise. It's not that I think external expertise isn't useful, but it just seems a bit weird that you kind of trust that over your local people.
Professor, we have to leave it there, but thanks a lot for your insight this evening. Professor Francois Venter, who was actually a member of the COVID-19 Ministerial Advisory Committee, confirming there that indeed that committee has since been disbanded.